welcome back to Simply Women's Health with CJ. Today we're going to talk about everybody's favorite part of prenatal care, the ultrasound. An ultrasound is a procedure that is what's called diagnostic in nature. The purpose of the ultrasound is to gather information about your baby. Ultrasounds are a lot of fun. It's an opportunity for you to come in and actually see your baby that's growing inside of your uterus. It is done by either an ultrasonographer, a person who's been specially trained in performing ultrasounds. It can be done by your medical provider, your doctor. It can be done by your midwife. It can be done by your nurse practitioner. Those are all providers that have received extra training in ultrasound, and they too can do the procedure. During pregnancy, we recommend typically that you have an ultrasound early on in the first trimester. The reason for that ultrasound is going to be threefold. First of all, we want to make sure that that baby is in your uterus where it belongs. We're going to want to count how many babies are in there, and they are also going to want to do dating. They're going to do some measurements and make sure that you get an appropriately signed due date so we know exactly how far along you are. Some doctors will order a nuchal translucency. That's an ultrasound that's done between 11 and 13 weeks. That is part of a genetic testing option. Not everybody does that, but that is some providers may order that one as well. In the second trimester, between 18 and 22 weeks, your provider will probably order what is called an anatomy scan. The anatomy scan is a big ultrasound. They're going to look the baby over head to toe. There's a number of different things that they need to take pictures of, measurements of, so on and so forth. They're going to look at the baby's head, the brain, the heart. They're going to look at the baby's organs. They're going to look at the baby's limbs. They're going to look at the baby's face. If you have not already found out the gender of your baby, oftentimes you learn that at your anatomy scan. They also need to look at your placenta. They need to look at where the cord is inserted inside the placenta, and they also need to look at the amount of amniotic fluid you have surrounding your baby. Sometimes we have babies that are stubborn. They are laying flat on their tummies or they're folded in half, and the ultrasonographer can't get what they consider optimal views. For those babies, oftentimes they will schedule a follow-up ultrasound in 4 to 6 weeks just to finish their survey. Now, a lot of patients get to this point and want to know when is their next ultrasound. Honestly, we don't know what the long-term effect of repeated ultrasound exposure is. To date, we have no reason to believe that they cause any harm. However, medicine changes over time, and therefore the American College of Obstetrics and Gynecologists, ACOG, recommends that we limit ultrasound exposure to what's called medical necessity. Now, if you have a pregnancy that is high risk for whatever reason, your blood pressure is elevated, you have diabetes, anything, you've got multiples in there, your provider may want to order extra ultrasounds. They want to monitor the baby's growth. They may want to keep track of the amount of fluids surrounding your baby. Sometimes they will order what are called biophysical profiles. These are ultrasounds that evaluate what's called fetal well-being. They look at a number of different factors and they come up with a score just to make sure that your baby is still better off inside than out. Typically right around 36 weeks, you may get a quick ultrasound just to make sure that the baby's head is down in your pelvis where it belongs. Some doctors will order a growth scan at that point as well. Again, it is all very provider dependent. If you would like to see what happens when you come in for your ultrasound visit, stay tuned.
So when you come in for your ultrasound, you're going to lay down on the bed. The ultrasonographer is going to use one of the wands. She's going to put warm gel on your belly, and they're going to put the wand on your belly, and they're going to pull up images of the baby. She'll be able to see, or she or he will be able to see the baby on the screen in front of them. In our clinic, we actually have a big screen TV that looks like this, that you're actually able to watch the images of your baby while the ultrasonographer is doing his or her scan.
Hi, if you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement for a visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.